Hello everybody, this is Ali from the British Society of Implant Dentistry. My colleague Punit Shah and I have done a short video on implant complications that will help guide you in dealing with patients with implant complications during this COVID-19 crisis. Just a short note on who we are. We are 4 clinicians, 2 prosthodontists, 1 PhD researcher, and myself, Ali, MSc Implants Dentistry. We got together to create the society that advances dental implant dentistry teaching and evidence-based practice. If you have any questions, go to our website or email us at info@bsiduk.com and we will be very, very happy to help. So now just handing you over to Punit Shah to begin his section on prosthodontic complications.
Hello everybody, my name is Punit Shah. I'm a specialist prosthodontist. I practice in London and we thought we'd do a small presentation in these times of COVID regarding the simple prosthodontic complications that can happen with dental implants. I'm going to mainly deal with the late stage complications that happen after osseointegration because this is really what we're going to be seeing. The main complication that we are going to be seeing in most cases is abutment screw loosening, and patients are going to call up and say that the implant crown is moving. This is quite common and it usually occurs with single unit molar crowns. There is an approximately 8% incidence rate. However, it can vary depending on different implant systems. I'm not going to go into any complications of these, but just to say that when they do call up, the main thing to ask is if there is any pain, especially on pressing around the implant. If there is no pain, it means that usually it's just the abutment screw that is loose, but if there is pain, it could signify that there is some loss of osseointegration. Also, when the patient pushes the crown up, they will not be able to detect any movement of the crown because essentially, if it's an internal hex implant, the crown will go back into the hex. The main thing to do with screw loosening of implant crowns is just reassure the patient, tell them to have a soft diet, and once everything's over, you can see them again and start retorquing the abutment screw. It is not a life-threatening emergency and there should be no pain associated with it. If the abutment screw loosens so much that the implant crown actually comes off, then all they have to do is not to worry, keep it clean and keep it safe. Now, something else that may happen is abutment screw fracture. This is not as common and in most cases will not involve any pain or swelling. In that case, the mucosa will heal over and you just need to reassure the patient that once the crisis is over, we can use the many well-documented techniques to try and retrieve that fractured abutment screw and possibly make a new implant crown. If there is a fracture of the restorative material, again, it's not a big issue because in most cases the sharp edges can be smoothened. Now there's many people who are recommending using nail files or temporary fillings and all sorts of stuff to try and smoothen any sharp edges. But eventually, when things are back to normal, you'll have to get the patient in to repair or replace that crown. So another thing that will happen is with cement retained single crowns, there can be debonding of those crowns. If it's an aesthetic concern, then they can drop a little bit of Vaseline into the crown and try and sit it back. Essentially, I would basically advise them that if it does come off again, then keep it out because there is a risk of ingestion or inhalation with it. If it is not an aesthetic concern, then obviously just clean the area, keep it clean near the abutment and keep the crown off. Something else that can happen with screw retained crowns or bridges is that you could lose excess cavity cement. If this happens, it is obviously not a massive issue. They can actually get some temporary cement from the local chemist and plug the excess cavity if they want to. If not, then they can just keep it clean and when you see them again, you can plug the excess cavity hole with your proprietary cements.
Hi everybody, it's me again, just taking over for the infections bit. So as you can see here, this is a picture from an online lecture, it's not mine. This is healthy gum, this is mucositis, just infection of the gum around the implant, the mucosa around the implant. And this would be peri-implantitis, where you can probe into the implant, there's suppuration, and there is evident signs of infection in the mucosa. If there is access to an X-ray, then this is the kind of image that one would normally see. It's called sauterization around the implant. So it's a uniform loss of bone which tracks down the threads of the implant gradually. And the primary cause of this is, of course, dental plaque. So we're not allowed to do any aerosol generating procedures. You have to do the absolute minimum possible. Most treatment at the moment is in urgent dental care centres. What do you need to get your patient to do? Well, ask them if they've got mucositis. Obviously, you won't really know the difference, but in any case, they're going to have to do lots and lots of flossing around the implant with this crisscross technique. Interdental cleaning around the implant using some chlorhexidine gel if possible. And the best one for deep pockets around implants is the single tufted brush. And if they can insert that into the area that's bleeding, obviously you tell the patient if it's bleeding, clean it more if you can. Or obviously the use of chlorhexidine mouthwash is also useful. Antibiotics, normally these are quite deep-seated infections, so you give them the usual cocktail of amoxicillin and metronidazole, assuming no allergies and no contraindications to doing so. Stronger still is co-amoxiclav if necessary. Azithromycin has been tested and given for 3 days. This usually has almost the same effect as the combination of amoxicillin and metronidazole. Obviously, these antibiotics are pretty strong antibiotics used more frequently in acute upper respiratory tract infections, so please use them sparingly. However, the times we are in necessitate that we probably err on the side of caution. Azithromycin 250 milligrams QDS is slightly out of fashion these days, but is a replacement for amoxicillin. If you don't give metronidazole, you're not going to treat the infection. If you don't give metronidazole, the infection will probably not go completely, because the majority of bacteria in this infection are spirochetes and anaerobes, and metronidazole is very effective against them. If there is a contraindication to metronidazole, then often azithromycin or just amoxicillin or co-amoxiclav. So this is a video of a failed implant. Please click play to see it. It shows clearly what a really badly failed implant would look like in the mouth. The obvious treatment for a failed implant is to remove it. There is no way to make an implant that has failed better. The reason being that it's now surrounded by a bag of fibrous infected granulomatous tissue. There is no possibility for the implant surface to magically become sterile and to induce second osseointegration. That doesn't happen. So the only treatment for a failed implant is to carefully remove it. Obviously, this is COVID-19, so we do not have the ability to do socket regeneration or socket preservation or ridge preservation. Remove it carefully. If possible, perform some curettage with a sharp instrument like a sharp curette, and give antibiotics. Wish the patient well, and 99% of the time the bone will regenerate in some way, shape or form, and placement of an implant at a later stage may be attempted. Thanks everybody for watching. I hope that we've managed to make a tiny contribution. I understand that the majority of you watching at home probably do not have the ability to even go in and see your patients at this stage. Hopefully that will change as time progresses. However, at least you could potentially give your patients some advice and refer them to the urgent dental care centres. I wish you well. I hope you stay healthy. Look after yourselves, and thank you very much for watching.